Mitchell is the Met Office Joint Chair in Climate Hazards. He joins me from Bristol. Good to have you on the program with us. First off, how does heat affect our ability to work, and when does it become too hot to work?
Yeah, so there's a number of conditions which are impacted by the climate, including temperature and relative humidity on the human body. And essentially, the science behind it is that we as human beings, we sweat to cool off. And if we are unable to sweat, then we can't cool. We also can't sweat indefinitely. So if it gets too hot, there's not enough sweat in our body to dissipate that heat. If the relative humidity is too high, then that sweat can't come off of our skin because there's too much water in the atmosphere already. So those are the sort of problems which can really impact the human body, and this can cause failure of multiple organs. But heat stroke is one of the most common ones there.
What does this mean for people who already live in hot climates? India, for example, and we have health workers who are working in conditions where they can't have the air conditioning on now because the potential to spread coronavirus. And they're also wearing protective gear, which doesn't allow them any relief. And how will climate change make this even worse?
Well, one slight good news story is that the people who live in very hot countries have already done a very good job at adapting to these sort of heat stresses. So it's not quite as bad as you would think in that sense, although it is bad. And the PPE that they've got to wear has a number of problems. As you mentioned, first of all, it's very hard you sweat a lot in these things, so you lose a lot of your moisture straight away. Another way we cool down is simply by drinking water. It's a very efficient way to cool down. You can't drink water if you've got a mask on your face. You have to stop. You have to take off that PPE, and that's something that's a serious problem. Now, we know that temperatures are increasing in the future, and we know over land they're increasing a lot more than, say, over oceans. And of course, we live on land, which means if we follow the Paris Agreement climate goals of 2-degree climate increase, that would actually be more than 2 degrees over land, and that will be much more in cities because cities trap heat. So in India, places like Delhi, temperatures are projected to increase by 5, 6, 7 degrees, which is incredibly bad for this sort of problem.
It's hard to imagine. What are some of the solutions here? You talked about people, health workers in their personal protective gear, not able to take off their masks to drink water. But what are some ways that we can ensure workers who have to be in these conditions can be safe?
Well, the first thing is to put in good heat action plans when certain thresholds are met. Some countries do this, other countries don't. I'm not sure, for instance, if India has one of these plans in place. America have one, for instance. The UK has one as well. And essentially what the heat plans say is when the heat stress, so that's a combination of temperature and humidity, get to a certain level, then the government will advise that people stop working. When they get above a particularly high level, which is often around 30, 32 degrees, wet bulb temperature that is, then they advise that all workers stop work. Often there are financial incentives, so those workers still get paid. Without those things in place, then people will just work to the bone. Unfortunately, with COVID, it's a crisis. It's a virus crisis on top of a climate crisis, so there's no easy solution to this. And this is why you need to sort the climate problem out earlier, because other crises will come in its wake.
Yeah, we certainly are at a critical point. Dan Mitchell, thank you.